Hi, I'm Ann Lila, and I'm coming to you from the North Carolina Research Campus, which is down south about 2 hours and 15 minutes from here. And it's a campus that's totally dedicated to human health through all kinds of different technologies that bring us together on human health. You're all located up here at the Research Triangle, but we're down closer to Charlotte. And we're trying to make North Carolina kind of a global center for these activities. Now, this building here, this is the Plants for Human Health Institute. That's North Carolina State's operation, our presence on the campus, and we do everything from looking at components of plants that when you ingest them, interact with human therapeutic targets to improve your health, to prevent chronic disease, or to improve metabolism. Everything from whole foods to functional foods, dietary supplements, all the way to phytopharmaceuticals, or things that you would actually put in a pill. And you might think fruits, vegetables, eat them, they're healthy, they're good for you. It's no different than what your grandmother always told you. But it's really a lot more than that now, because we have the technologies that we can really discover what these components are and how best to use them for health. For example, going back to the Second World War and some leads for malaria, including cornus, your native North Carolina tree here, that have components in them that are actually really beneficial antimalarial compounds, antiplasmodial compounds that can be alternatives to the common therapies that are out there now that are starting to develop resistance. We're also working with animal models looking at how to prevent the biomarkers of diabetes and obesity, and looking at how certain components of plants can lower blood glucose levels very effectively, as well as metformin, which is the drug of choice for diabetic patients. So these kind of compounds in plants, which are so important for human health. But even though we're learning these discoveries, and even though people know what they're supposed to eat, people just don't do it. And one of the challenges for functional food industry is to get a beneficial efficacy or the beneficial dose of bioactive compounds from a plant in a dose and in a form that people will eat, like a functional food. And that's one of the technologies we're working on now, where we're able actually to sorb or bind beneficial compounds from fruits and vegetables and other herbals onto a high protein matrix and use it as a functional ingredient. So you can get in a few grams of this material in a smoothie or in a cracker or in a bar. You can get your two doses or 2 servings of fruit or vegetables in that same functional food matrix. But then we wanted to take this, and this is funded by a couple of federal agencies, and then we wanted to take it to the next level, to look at it as a biofortification strategy for the developing world. So take it to a more humanitarian level, or more with a social conscience, not just commercial, but also to that level. And we were able to get funding through the Bill and Melinda Gates program to bring this to Zambia, where there is a 45% rate of what they call stunting, which is malnutrition in the country, and that's countrywide. Average age of women to have children in Zambia is 16. Average number of children is 6. And huge problem with malnutrition in the villages. So we wanted to take this technology for concentrating bioactive compounds from fruits and vegetables that aren't available year-round, put them in a matrix that they could use year-round that would be shelf-stable. And so working with Rutgers University and North Carolina State, together we gave them a cost-free license to take fruits that are in their own domain that grow in the country, like guava and mango, and substrates like peanuts and soy, and use those as matrices to then concentrate the goodness of mangoes and guava in these shelf-stable matrices that will last for a year or longer in the rural villages, to empower women, to empower communities that don't have a source of income, and to help attack that problem of stunting or malnutrition in the country. We've worked with local industries, we've worked with pilot plants in the country, we've worked with the ministries of health, ministries of science, all on board, because we're giving a cost-free license for this technology to Zambia to start to attack this problem of malnutrition. We've really been really thrilled with the reception that we've been getting from the community, and just excited about the whole opportunity. Thank you so much.